next procedure, ma'am, is a bed bath. So bed bath is a bathing procedure performed on a person who is unable to bath independently, typically while they remain in bed. So the purpose of the bed bath is to maintain hygiene, promote comfort, and prevent skin issue for individuals who are unable to bath themselves independently. So the equipment of the bed bath is the bedpan, urinal, cloth or towel, blanket, basin with a warm water. So that's all, ma'am. Thank you. So now, we're going to do the assessment of the bed bath. So first is, assist the client tolerance in activity. It promotes the mobility and the independence independence of the daily task. So, ma'am, pwede na mo taas yung kanang kamot sa dali, ma'am, sa taas. Thank you, ma'am. Pikas na sad, ma'am. Thank you, ma'am. Then, second is, assist the temperature or ventilation to ensure the comfortable environment for the client during the procedure. Then the next is, wash your hand to maintain hygiene and prevent the spread of infection during the procedure. And now we're going to gather all the necessary equipment, streamline the process and ensure efficiency. Then the next is, we're going to provide privacy by closing the window and the door so the client can feel comfort throughout the procedure. And now we're going to offer bedpan or urinal to address client elimination needs and prevent discomfort. Next is, adjust the bed to a comfortable working height position. Facilitate ease and access and maneuverability during the procedure. So as if, ma'am, na ato nang i-adjust ang bed. And the next is, place bath blanket over the client before removing the top sheet. It is to maintain the warmth and dignity during the undressing. And the next is, remove the client gown, ensuring he or she is covered with a blank blanket. Removing the client gown while covering with a blanket, maintain privacy and dignity. And the next is, pull side rails up and fill basin with a warm water. Warm water ang gamiton, ma'am, kay para dili makurat ang patient, ma'am, while magtrapo ta, ma'am. Then the next, place the client in a semi-fowler position and remove the pillow if permissible. So before we start, ma'am, we have to check the client record if the client is able to do the semi-fowler position without any complication. And now application. So the client is pwede siya maka-semi-fowler, ma'am. And then the next is make a mitt of the clothes. It is to maintain, or it is an effective way to cleaning and prevent being dropping or losing the clothes during the procedure. And the next is wash the client face, ears and neck, rinse, pat and dry to prevent the infection or discomfort. And now is wash arm away from you, fra- from distal to proximal, including the axilla, using a long firm stroke. This to maintain hygiene and to promote comfort. Then after is we have to rinse, pat and dry, or rinse and dry the clothes we use. And next is we have to wash the client hand with basin, rinse and dry. This to ensure the comprehensive cleaning and to prevent the infection. And the next is we have to wash the chest abdomen using a long firm stroke, then rinse and dry. And the next is we have to expose one leg at a time and wash leg far from you using a long firm stroke. Then we have and the next is we and then we have to rinse and pat and dry. And after that we have to repeat the procedure from the leg near you. And the next is immerse the client and wash the client feet in the basin, rinse, pat and dry. And the next is we have to replace the water. And the next is turn the client on his or her side and place the towel alongside of the alongside of the back, and wash the back and the buttocks with a long firm stroke, then pat and dry. The next is place the patient in a supine position and cover with a cover with it with a bath blanket, and then wash the perineal area, rinse, pat and dry. But if the patient is able but if the patient is able, place the towel under the place the towel under the buttocks, and bring the basin and the soap within the client within the client reach and instruct the client to complete the bath of him or herself. So, ma'am, can you wash your perineal area, or do you want me to do the honor? Manage. So, thank you, ma'am. And then the next is have the client wear have the client wear a new gown and combed hair, and you and I mean have the client wear new gown and combed hair, apply lotion if desired, if desired by client. So, Do you want to add lotion, ma'am?
I'm sorry.
Okay, ma'am. And the next is remove the equipment, and the next is remove the equipment and use and store them in a proper place. Store them in a proper place to maintain cleanliness and organize in the care environment. Then the next is wash your hand to maintain cleanliness and to prevent the transmission of the microorganism. Next is evaluate the client comfort. The client comfort ensure that their needs are met and promotes a overall well-being. So, ma'am, are you satisfied with my procedure, ma'am, or do you feel comfort, ma'am?
Yes.
So, thank you, ma'am. And the last one is document the procedure to include the type of bath administered and client respond. It is by facilitating or continuing the care and monitoring of the progress. That's all, ma'am. Thank you.